In today's video, I had the pleasure of interviewing Callie, otherwise known as the Bladder Dietitian. Callie is a registered dietitian specializing in bladder health. Her passion is interstitial cystitis, as she has lived with IC her entire life, but she also enjoys helping people with conditions like overactive bladder, chronic UTIs, and incontinence. She is the founder of Callie K Nutrition, the ICU podcast, and social media accounts at Callie K Nutrition. These accounts have helped hundreds of people with bladder pain, frequency, and urgency get relief from their symptoms through diet and lifestyle changes. Callie currently serves on the board of directors for the Interstitial Cystitis Association. In today's video, Callie shared her expertise with us on IC. We spoke about what IC is, how it overlaps with endometriosis, how it's diagnosed, medical management options, and natural options for symptom relief. If you are somebody with endometriosis and IC, or this is a subject matter of interest to you, this video is for you. Happy watching. I'm joined by Callie today, as I would have introduced in the introduction to the video. So thank you so much, Callie, for taking the time to chat with me today. Our big topic is interstitial cystitis and endometriosis, and I understand there's a huge overlap between these two conditions, and you being an IC, or interstitial cystitis, IC for short, specialist, I thought you'd be a great person to have on to chat on this topic. So I'd love for us to just start off with you introducing yourself. Who are you? What makes you a great person or expert to chat with about interstitial cystitis?
Yes, thank you for having me. So I'm Callie Kreitzer. I am a bladder dietitian. So I started out as an IC dietitian and then I branched out into the overactive bladder world. So we're just calling me bladder dietitian. I personally have struggled with IC for the first 25 years of my life. I eventually found out how to get relief on my own, not even through like my doctors or anything. So that is what kind of made me want to help other people who are also struggling from this condition. And I have learned so much over the past like 4 or 5 years of doing this that my approach is like completely different than what it was when I started, which is really cool. And we can definitely talk more about. But yeah, and I've worked with, I think, over 180 IC warriors now. And we do have a subgroup of them that do have endo as well. And people are getting relief. So that's like the biggest takeaway I want people to take from this is that, you know, people may tell you you can't get relief from IC, but you totally can. And like, that's really my main takeaway here.
I love it. I love to hear that. And I think that it sounds like there's a lot of similarities in our stories, because as somebody with endo, like you're the one who has the IC, I'm the one living with endo. You don't have endo as far as I know, right? Yeah. Same, like I spent years trying to maneuver through all these different management options. And when I started my practice, I really wanted to streamline that for people. And it sounds like you're doing quite the same. You're trying to simplify this, shorten the journey to symptom resolution for people with IC. So I think a great starting question here would be, you know, what is IC? I'm using the short form IC, but that stands for interstitial cystitis. So what is that? What are some symptoms people can keep their eyes peeled for to kind of help them tease apart if they may be living with IC and endo, or maybe just IC?
Yep. So interstitial cystitis can also be referred to as bladder pain syndrome. The nomenclature is somewhat confusing, but we don't have to get into it. They can kind of be used interchangeably. So we will refer to it as IC. So the symptoms of interstitial cystitis are essentially the same as those of a UTI, a urinary tract infection. So if you've ever had one before, you think like that burning bladder pain, it feels like you're peeing fire. The spasms, the frequency, the urgency, feeling like you have to get like one drop of urine out and it's going to make your life so much better. And then you realize it's not. That's essentially what it's like with IC. And the only main difference there is with IC, there is no infection present when you get your urine tested. And not everybody with IC has the same symptoms or all of those symptoms that I mentioned. For me, it was primarily bladder pain for my whole life. I did kind of develop some frequency and urgency down the line, but for the most part, it was mostly pain. So those are generally what the symptoms look like. And it's always super interesting because when you think about endo, I mean, the symptoms can be similar when there is endo near the bladder or on the bladder, right?
Right? Or on the ureters. Yeah.
Yeah. So those are the basic symptoms of it.
Yeah, interesting. I wanted to ask you because it's crazy to me how many people I meet or connect with who describe these type of symptoms, and then when they go to their doctor, it's like repeat antibiotic after antibiotic after antibiotic. And then what I end up finding with these people, because we know that there is such a significant overlap between the gut, like your health of your gut, right? And then endometriosis, symptom severity and progression, couple months or years down the line, these people end up developing like extreme severe symptoms of endometriosis, like large endometriomas, pain almost every day of the month, not just around these like high pain phases of the cycle or high estrogen phases of the cycle. So my question to you is it common? Is it similar with IC to also be prescribed antibiotic after antibiotic? And then does that have a role to play in how the condition unfolds? Does it get worse?
Yeah, it really depends on what the doctor wants to do. I think a lot of people go to like urgent care or their PCP and their doctors are like, you don't have an infection, but let's give you antibiotics because this looks like an infection.
Mm-hmm.
So, a lot of people will get stuck in that cycle. And I think some doctors just don't really pay attention to, oh, this person's having repeat infections, but they're not actually infections. So usually people will get referred to a urologist or a urogynecologist, and we always hope that they know what they're doing, but not everybody does. I hate to say, when it comes to treating these symptoms and diagnosing something like IC, so they can run a lot of different tests. I can get into it if you want, but and to answer your question about like, is it something that will get progressively worse? In my experience, no. Unless you're somebody who has what we call Hunner's lesions. So these are open wounds on the bladder wall, and it's estimated that about 5 to 10% of people with IC have these lesions. So it's difficult to say. I haven't seen any evidence that says like people with Hunner's lesions do get worse, but I have heard just through support groups and, the grapevine that that can be the case. But for me personally, my symptoms only got better with time as I figured out my triggers, as I, addressed the underlying causes of my symptoms. And I do think that is also applicable for the majority of my clients as well.
Any overlap that you're aware of between these lesions and endo?
Not that I know of. Nope.
Okay, two wildly separate
I
conditions.
think they are, yeah.
Okay. So I think you kind of already alluded to a little bit of how endo and IC can overlap when there's like endo on the bladders or on the bladders. On the bladder, we have one, or on the ureters. Is there any other overlap that you could provide a bit of insight into? Or is that just
Um, I am just thinking about like in my clients that either come to me with endo or they, end up being diagnosed eventually with it. They usually are people who notice their symptoms get worse when they're either on their period or around their period. Even sometimes people who get symptoms or get flare ups, we call them, during ovulation. Like if it's something that seems to follow a pattern with your menstrual cycle, that's kind of one of the most common complaints I've heard in my clients with endo and IC.
so they're IC symptoms, but they'll intensify around these like higher pain phases of the cycle. Okay. So
Mhm.
keep your eyes peeled if you get like a bladder urgency feelings or sensation of like peeing fire. Um, could be IC and maybe, compounded on top of endometriosis. So, okay, very helpful. Um, I was going to ask also in terms of endometriosis and IC, um, actually unrelated, sorry, to this. So, how is it diagnosed? Is it a diagnosis of exclusion?
Yeah, it's a diagnosis of exclusion. So doctors may want to do some testing, maybe a transvaginal ultrasound, MRI. They just want to rule out every other possible explanation. A lot of them will do a cystoscopy, so a scope of your bladder. They're going to look at the bladder wall, see if there's anything in there. We want to make sure there's no cancer or anything like that. Um, but that is also where they would typically see Hunner's lesions if they are there. But for the majority of people, like I said earlier, about 90%, 95% of people will either have a completely healthy looking bladder or it'll just look a little bit angry. And so that is where people get, confused and frustrated, and that makes sense. You have all of these really severe symptoms and there's nothing visibly wrong with your bladder wall. So, yeah, that is a really interesting thing about the diagnostic process. Some doctors will, at that point, diagnose with IC. Other doctors aren't comfortable diagnosing people with IC if they don't see lesions. So it can get complicated.
Yeah, it sounds complicated for sure. And then how is it typically managed? And I'd be curious about your response to this question, both from like the sort of Western medicine side of the equation, but then also I'd love to dig in a little bit deeper into like the nutrition side and what you do.
Yes, this is a great question. So, yeah, the typical like medical treatment, what doctors will do is there's medications they will prescribe. Um, I don't know if you want me to name any of them, but like amitriptyline, hydroxyzine, which is a antihistamine. Um,
Interesting.
there's a med called Elmeron, which was helping a lot of people, but it's coming out that it's causing or can cause eye issues. So people are like pulling back on that now. So there isn't a medication that works for everybody with this condition. There are more, procedural type treatments like a hydrodistension, which is they put you under anesthesia and they put fluid in your bladder and they essentially stretch it. So some people, I would say I've heard like 50-50 in terms of whether that helps people or not. It did not help me. There is something called installations where they put a catheter in your bladder and they insert like liquid medication into it and you hold that in for a while. And again, another trial and error type treatment. More on the like less invasive side, pelvic floor physical therapy would be like one of the top treatments recommended. I'm hoping most doctors are recommending it because that is just super, super helpful. And I believe it's helpful for endo too, right?
Oh yeah, 100%. There's a lot of literature to speak to the value of pelvic floor PT for sure. Yeah.
Yeah, definitely. So there's that. There is, diet. Diet is something that I've had a love-hate relationship with when it comes to IC. So there's something called the IC diet, and it tells you not to consume bladder irritants like coffee, alcohol, carbonated beverages, citrus, tomato products, chocolate, artificial sweeteners, soy, like literally everything that anybody ever has enjoyed. The doctor will give you a handout and they'll be like, stop consuming these things. And that's usually it. They send you on your way. And it's like, holy crap, these were my favorite things. I'm kind of mourning this right now. It's really overwhelming. And most doctors won't refer to a dietitian. And if they do, the unfortunate thing is that most dietitians have never even heard of IC before. So that is a really frustrating thing. I don't know about you, but I never learned about IC or endo or any of these conditions in my schooling.
No, yeah. You have to be self-taught. You have to do more advanced trainings. Yeah, for sure.
Exactly. So the IC diet essentially was created after researchers they sent out this questionnaire asking people with IC, what do you think you are sensitive to in terms of food? So it was a couple hundred things on this list. This was back in 2007, and they all, snail mail sent back their responses. They got about 105 responses, and then that's how they created the IC diet. Now, the intention of the IC diet with those researchers was to be used to find your unique triggers through an elimination diet, which is great. I mean, I'm all for the elimination diet, especially when the research behind the diet is not very strong. But
Right.
for the past few decades, this has really been misconstrued in our community, and all of a sudden, the majority of the IC community thinks that you need to follow the IC diet to a T forever. And now I'm seeing a lot of people developing nutrient deficiencies. They're eating the same 5 to 10 foods. They're losing weight unintentionally, and they're developing food fear. People are terrified to eat because their doctors have told them, these foods are bad. And, that your nervous system will start to perceive these things as a threat, which stress is a trigger for bladder conditions like IC. So, as you can see, this is something I'm very passionate about. And the way that I recommend this for my clients is, okay, we are going to, figure out what's at the root of the problem. I've been having my clients work on managing their stress and working on calming their nervous system for a couple of weeks, and then I'll have them do an elimination diet to determine if they are diet sensitive or not, because that's the other thing. The majority of my clients are not diet sensitive, and we've been told by our doctors that you probably are. So it's really, really confusing for just the general community, and that's really what I'm trying to do, is raise awareness for, you don't need to follow this diet forever. You may not even be diet sensitive, and you probably can be consuming these irritants, in moderation and like living your best life. So that's the end of my tangent. Let me know where you want me to go from here.
Yeah, I love that you said that because it's there's a lot of overlap with a lot of that wisdom you just shared with us when it comes to endometriosis. Like without fail, every single time I post content on like soy for endo, dairy for endo, red meat for endo, caffeine for endo, I have like 30 DMs like, aren't these foods bad for endo? Aren't these foods bad for endo? Shouldn't they be avoided? And like diet, it's endo diet I see is my impression from what you just said are just not that simple. Wouldn't it be so fantastic if you could just pull out like 3 or 4 or 5 foods and then all of your symptoms would go away? I'd love for that to be the case, but it's just not the case. And like you alluded to, there's so much value to some of these foods when you, in your mind, tell yourself, convince yourself that these foods are bad, then you start developing all this food fear. It sounds like there's probably a lot of disordered eating in the IC space, which is very similar in the endometriosis space. And like I'm with you, Callie, like till the day I die in this space, I'll be advocating for as liberal of a diet as we can manage with endo and, in your case, IC, because you can never just take one food and narrow it down to the saturated fat content or, the caffeine content or the phytoestrogen content. There's so much nuance to diet, and more than likely there's a lot more value in these whole food sources to your overall health than pulling it out because of one food component or one thing that you maybe read somewhere, 5 months ago that it's bad for IC or for endo. So yeah, really appreciate that. It does sound like diet, just much like with endometriosis, that diet can be a trigger though for IC. It sounds like stress, much like endo, can also be a trigger for flares and symptoms. Do these triggers fall under like different categories? Like, is it more than just diet triggers, stress triggers? Is there more that you've seen? What about supplements? Or can supplements be triggers?
Supplements contain, let's say, citric acid or vitamin C. Those are two, of the bladder irritants on that IC diet list. And someone is diet sensitive, then yes, it could be bothersome. But I would say, again, not for everybody.
Okay.
So, yeah, we have the diet. And I do want to say, like, people can be diet sensitive. I'm not like saying nobody is.
Hmm.
But in my experience, there is something else going on underneath that that diet sensitivity is usually a symptom of something else. So let's say pelvic floor dysfunction. If your pelvic floor is too tight, it's dysfunctional, it can produce all of these symptoms of bladder pain, frequency, urgency, whatever you're experiencing. And that can increase your bladder or your diet sensitivity. Because if the nerves of your bladder wall are irritated and you're eating things that are, bothersome for the bladder, it's kind of like putting, let's say you're cutting a lime and you have a cut and you get lime
Mhm.
juice on it. Like that's essentially
Mhm.
what could be happening. Do we know for sure that's exactly what's happening? No. But, hopefully in the future we have the research to prove that. But so yeah, diet can be a trigger. The pelvic floor. So many people, especially women, hold their tension in their pelvic floor. So that is a big one. It's a big one for me. I
Mhm.
need to tell myself right now, stop clenching your pelvic floor. Stop crossing your legs. Um, in terms of gut health, constipation, diarrhea, anything out of the ordinary with bowel movements, that can be a trigger. Tight pants, maybe really strenuous exercise, those can be triggers. Sex is a pretty big one for people who struggle with bladder pain. Um, there can be like scented or fragrances in your detergents, like things like that for people who are more sensitive in terms of like their skin and all of that. So, yeah, I just threw a bunch of triggers at you, but I would say the top triggers are the pelvic floor dysfunction, hormone changes,
Mhm.
fluctuations, that can be an issue, even if someone doesn't have endometriosis. And then, yeah, diet again.
I don't know if this is something you can answer, but are you familiar with why hormonal changes specifically might be an irritant? Like, is it just prostate, like if it's hormones leading into the cycle, for example, is it like that uptick in inflammatory prostaglandins? Do they act on the bladder? Like, is that the overlap there or?
So this is a topic that I am not confident in. I don't know why, but no matter how many times I learn about hormones, like I struggle to retain it all. But I did do a podcast episode with a IC like urologist,
Mm.
and she was explaining, why. I think it was because when you're ovulating, is estrogen low or high?
Hi.
High. So I think it's just that big change in estrogen, and then when you're on your period, it's low, right?
Right.
So yeah, that was like her hypothesis, but we don't have any like solid proof that this is what it is.
Is the bladder smooth muscle?
Yeah, it's muscle that's covered by like this mucosal layer called the gag layer.
Okay. I don't know if it's like I wouldn't know. This is not my area of expertise, obviously, but I know, like, for example, progesterone acts on smooth muscle. So a lot of women who like supplement progesterone, which is a common intervention for endo, notice that their bowels slow, right? So I wonder if there could maybe be a little bit of overlap there. It definitely makes a lot of sense to me that somebody with endo or like a hormone sensitive condition would have an uptick in flares or symptoms. I don't know about the rest of the population, but then we also know that prostaglandins skyrocket around the period. So maybe if the prostaglandins are acting on the muscle of the bladder, maybe that's when one overlap there. Callie, you had mentioned something previously about antihistamines being a treatment. Is there any, you might hate me for asking this question, but is there any value in like a low histamine diet or like maybe some natural supports like DAO enzymes or quercetin or stinging nettle? Is there any benefit to those for IC symptoms?
Yeah, I would say for some, not all, from what I have learned just in the research, there's no proof that IC is like a histamine issue, but it does seem that there is a subgroup of people with histamine issues. So interventions like what you mentioned there. Yeah, I mean, quercetin is pretty high at the top of the like recommended supplement list for IC, so that could be helpful. In terms of my clients, we've only had a couple people respond to a low histamine diet.
Mm.
So, and also the IC diet is fairly low histamine already. So if someone's already following the IC diet, chances are it's pretty low histamine. A really hot topic in the IC community is low oxalate. little
Mm,
obsolete. I don't know how you say that word, but not proven either. But
yeah.
my take on all of this is like, okay, if you are doing all of the lifestyle changes, you've tried all of these other things, you've tried the diet, and you're still not getting relief, and that's something you want to try, I mean, go for it. But be careful, removing a lot of different foods from your diet, you're going to be missing out on nutrients. So I
Mm.
always recommend, work with a dietitian if you can. If you can't, then, just be really, really careful about staying nourished.
Yeah, I agree with you 100%. I mean, if you start pulling out major food categories, you're going to develop some pretty significant deficiencies. And, for endometriosis, a lot of those deficiencies have, we have literature. We have literature for low calcium leading to more cramping, magnesium leading to spasming of the fallopian tubes or of the uterus, retinol, vitamin D for the immune response, vitamin D deficiency being a risk factor for endometrioma development, and I can go on, right? Are you aware of any nutrient deficiencies that have that level of significance? I mean, the body doesn't function in a silo, right? Like every organ relies on something else to function properly. So I imagine the answer to this question is like you want to be really well nourished, right? To avoid.
Yeah, exactly. And
Yeah.
and two nutrients of concern with IC is vitamin C and vitamin B6 because those are on the I or they're not on the IC diet list. Like they're recommended to avoid.
Mm.
And I mean, I hate that. So, it's recommended to do like a buffered vitamin C, but again, people read vitamin C is bad, so they cut out like every single food source of it and B6, and it's like you cannot do that, especially if you're not supplementing. Like, and then you start getting all of these weird symptoms, and that can be like you could be developing scurvy. Like,
Oh.
we we don't really know. So, yeah, that's one that we see a lot. And then, I mean, women in general, like the vitamin D deficiency, I mean, in general for pelvic health, I mean, that's a big one. And if you live in a place that's cold in the winter and dark like I do, it sucks. But that's when you need to really be watching.
Yeah, you need to be watching it because you won't get it from the sun, right?
No.
Um, yeah, I mean, because this recording is on IC and Endo, I mean, B6 is a major precursor to progesterone, and progesterone challenges estrogen, and we know endo is estrogen dependent. And so, if you're doing this type of diet that's very low in B6 or is completely devoid of B6, excuse me, you're really not setting yourself up for success there, right? Because now you might lower your progesterone production, and then your estrogen will go unchallenged. And then that could lead to more pain, more PMS, estrogen excess symptoms. Vitamin C, we know, is huge for the immune system. It's a really important antioxidant that we actually have a lot of research for in the endo space for helping with things like pain with intercourse and pain with urination and pain with defecation and pain with intercourse. So I just wanted to kind of slip that in there because that really matters if you're somebody who's living with both IC and endometriosis and you're looking to improve symptoms of both conditions. What about D-mannose?
Yeah, so D-mannose, I mean, we hear a lot about that with UTI prevention, but there is a company that is called West Coast Mint, and their founder, her name is Rochelle, and she taught me a lot about how D-mannose can also be helpful for people with IC because it has like those anti-inflammatory properties and a lot of other good things. So, I mean, that is something that can be tried, but is there literature and scientific evidence on it for IC? Not that I know of.
Okay, amazing, super helpful. Okay, bit of a generic question, maybe to end off our chat today. And the question is, top tips. I do imagine, based on this conversation, that one of those tips is really trying to find your kind of root cause, right? Like what's at the root. And then I know it's probably hard to answer this question because it really does need to be individualized. It's a massive topic, but if there's anything that you can offer to listeners who maybe are living with both conditions, I mean, definitely follow Callie and maybe consider investing in some support there. But other tips?
Yeah, so this is a great question, and I think I answer this every single day of my life right now. Yeah, you need to investigate what is I hate the term root cause, but there's no other term that really like embodies what I'm trying to say here. But we can also say underlying cause. And whatever that may be, I mean, the top root causes among my clients are that nervous system dysregulation. If your nervous system is stuck in fight or flight, and there's always like a perceived threat around you, your bladder is not going to know that it's safe to heal. It's going to throw all of these, symptoms at you. And that's really your body's way of communicating to you that you need to slow down, you need to address this. So that is something that comes up with almost every single one of my clients. It was my main root cause. The other one I mentioned earlier, pelvic floor dysfunction, get in to see a pelvic floor physical therapist or physiotherapist, wherever you're located. Wait lists are long, so get on there early and give it a solid try. And if it doesn't, work for you the first time, maybe go see a second or get a second opinion. Every PT is different. I got a lot of help using a pelvic wand. That is something you could ask your PT about, but it may not be something right away. Other tips would be, stay hydrated. A lot of people think that drinking less is going to make you pee less, and that is not true. It is counterintuitive. Dehydration is a trigger for all of these bladder symptoms we're talking about. So I usually tell people, aim for the 64 ounces or whatever that looks like in milliliters, and just monitor the color of your urine to determine, do you need to drink more? Do you need to drink less? Sip all day, don't chug, all of those things I'm sure you've already heard. Make sure you're addressing your gut health. Like I said earlier, constipation, diarrhea, any sort of IBS gut health symptoms, get those addressed. Don't believe anybody who says you have to follow the IC diet forever. You need to find your unique triggers through an elimination diet. Um, yeah, I mean, if you are going down that medical route, which no judgment, I've done like literally everything that was offered to me, know that all of these treatments are going to be trial and error. There's not one proven solution for IC, and everybody needs an individualized approach. There's no cookie cutter solution here. So understand that what works for me may not work for you. And last but not least, going back to what I started this with, you can get relief. Don't let anybody tell you you can't. You just need to figure out what's at the root of the problem. So I will mic drop there.
Amazing. And we've talked about several of those possible underlying causes that you can, start with to start that investigation. I just wanted to clarify in case anybody who's listening doesn't know what it is. A pelvic wand is like it's like some kind of a device, right? That you would insert.
Yeah, it's a tool that you can use outside of physical therapy. They also have a pelvic dilator. They're kind of similar, but they have differences. And it's a tool you can use to essentially do what a pelvic floor physical therapist does in session. They do internal work manually, and that's something you can do at home. I try to do it every day, sometimes
Nice.
every other day, and it just helps you stretch the muscle like you would any other muscle in your body.
Amazing. Okay, great. And then I just wanted to add one other thing to what you said, just to encourage people to take your words of wisdom and apply them, which is the hydration piece. A lot of those vitamins that you mentioned are at risk with the IC diet. The B6, the vitamin C, these are water soluble. You will struggle to absorb them. Your body will struggle to use them if you're not well hydrated. So you want to be
That's a great
hydrated,
point.
right? Callie, you're amazing. Thank you so much. Really appreciate your time. Callie, do you know, are you more likely to have IC if you have endo?
Yeah, so I was just doing a quick look on the internet because I haven't talked about endo in a while. And I saw that there was a study done in 2018 that followed more than 9,000 people with endo and more than 27,000 without endo over the course of 3 years. And it says researchers found that people with endo were more than 4 times as likely to develop IC than people without it. So that's just one study that was done. I'm not aware of anything else out there, but it's just interesting. And also, people call IC and Endo the evil twins. If you've ever heard that
Mhm.
term before, I definitely
Mhm.
wanted to mention it on here because the fact that there is a nickname for these two conditions together just shows that it is fairly common.
Yeah, 100%. And honestly, I'm not surprised. I'm not surprised at all. We refer to endo as a body-wide condition, but when you look at the literature around where is endometriosis located in the large majority of people, like, please nobody watching this come at me and be like, how dare you say it's a pelvic condition? That's not what I'm saying. But the large majority of it, when you collect a large sample size of people, it is on the ovaries, on the uterus, in the cul-de-sac, on the ureters, on the what are they called? On the uteral sacral ligaments, right? So we know that it does tend to, kind of accumulate more in the pelvic region, and so it makes a lot of sense to me that the like bowel symptoms would be more common, that bladder symptoms would be more common, right? Like that just to me seems logical. So, which is why I also think your points around pelvic floor function and like pelvic floor therapy are so valuable for both of these conditions, right? So yeah, love the statistics, love the little ad in there. So thanks so much. Thanks so much for watching today's video. Please be sure to like this video and subscribe to my channel if you haven't already, and I will see you in the next video.